Assalamualaikum to Sama. Today, me and my roommate are going to discuss about the Sustainable Development Goal and a related program, which is Sustainable Development Goal 3, which is Good Health and Well-being, and my VET program under Ministry Health of Malaysia. First, I would like to talk about the introduction. Sustainable Development Goal consists of 30 goals, which is designed to make our Earth a better place. These are a demand of action to eradicate poverty and injustice, safeguard the earth, and guarantee that all into such health, justice, and prosperity. It is essential that nobody is abandoned. Our group has chosen the Sustainable Development Goal 3. Sustainable Development Goal 3 is created to ensure and promote the health and well-being of all people of all ages. Health and well-being are essential at all stages.
I'm going to explain about the description of this program. Malaysia Vaccine Support Volunteers, known as MyVAC, is a specialist system developed in association with the Malaysian Red Crescent Society, MRCS, Ministry of Health, MOH, Ministry of Science, Technology and Innovation, MOSTI, Ministry of Youth and Sports, KBS, and Ministry of Higher Education, KPT, to support the implementation of the government's vaccination program by launching volunteer citizens who are willing to be a part of the vaccination team. Next, this program made by the government is to ensure Malaysia can achieve herd immunity, which means 80 to 90% of Malaysians should have 2 doses of COVID-19 vaccination. To implement this, government is inviting all Malaysian citizens who at least 18 years old and in a good condition of health to be a part of this program. In addition, healthcare workers with covered annual practicing certificate like physicians, dentists, pharmacists, nurses, and medical assistants (APC) can also take part in this program to ensure this program runs smoothly without splurging a huge amount of money. Lastly, to ensure Malaysia become herd immunity, the government prepares more than 605 vaccination administration centers throughout Malaysia, including secluded areas.
The vaccine program has had a significant positive impact on many of the Sustainable Development Goals. Vaccines have shown to reduce child mortality and morbidity, improve maternal health, reduce poverty and inequality, and increase life expectancy. Additionally, the widespread availability of vaccines can reduce the spread of diseases and improve public health. This in turn contributes to improve economic and educational outcomes, which are the components of sustainable development. Vaccines have also been a major factor in reducing the prevalence of communicable diseases, which is critical for the achievement of many of the SDGs. This impact has a long-term and far-reaching effect. It is not only affects the present but also has the implication for the future. It has the potential to shape and influence the life of many people for years to come, as well as has a profound and lasting effect that can be felt for a long time to come. Its effects are far-reaching and can have a lasting and significant impact on individuals, communities, and societies for years to come. In addition, the vaccine program has had a significant impact on reducing child mortality and morbidity in Malaysia. According to the World Health Organization, Malaysia's child mortality rate has more than halved since 2000, from 41 deaths per 1,000 live births to just 14 in 2018. This significant reduction can be attributed to the country's successful immunization program, which has been credited with preventing an estimated 3.2 million child deaths between 2000 and 2018. The country's immunization program has also been successful in reducing morbidity among children. The national immunization program has been successful in decreasing the prevalence of many vaccine-preventable diseases such as diphtheria, tetanus, pertussis, measles, mumps, rubella, and polio. This has had a positive impact in reducing the number of children with disabilities such as hearing and visual impairments, as well as other illnesses and complications related to these diseases. In brief, the vaccine program has had a positive impact on reducing child mortality and morbidity in Malaysia in the last 2 decades. This had a positive effect on the health and well-being of the country's children and families and on the overall development of the nation. Next, the vaccine program has had a significant impact on reducing poverty and inequality in Malaysia. In the past 2 years, the government has implemented various measures to increase access to healthcare, reduce the cost of healthcare, and provide financial support to the vulnerable groups. These measures include increasing access to healthcare through the establishment of health clinics, providing subsidies for medical treatment, and providing free vaccine for children. This has resulted in a significant reduction in the number of people living in poverty, as well as reduction in income inequalities. In addition, the government has also implemented various measures to improve the quality of life for poor, such as the introduction of social protection program, such as the One Malaysia People's Aid BRIM and the One Malaysia Healthcare Assistance Program 1MCA. As a result, these measures have helped to reduce poverty and inequality in Malaysia and are expected to continue to do so over the next 2 years. Lastly, the vaccine program in Malaysia has had a significant impact on reducing the prevalence and communicable diseases. A 2018 study reported that the number of new cases of communicable diseases in Malaysia decreased by 24.4% between 2007 and 2017. This was largely due to the introduction of the National Immunization Program (NIP), which was launched in 2007 and provided free vaccinations for infants and children against major communicable diseases such as measles, diphtheria, and pertussis. The NIP also included the introduction of a national program to vaccinate adults against the human papillomavirus (HPV), which has been linked to cervical cancer. This program has been created with significantly reducing the incidence of cervical cancer among women in Malaysia, as well as lowering the mortality rate of the disease. The introduction of the NIP has also been linked to a decrease in the prevalence of communicable diseases in Malaysia that are not covered under the program, such as tuberculosis and malaria. This may be due to the increased awareness and knowledge of communicable diseases among the general public, as well as the improved access to healthcare services due to the NIP. In short, the vaccine program in Malaysia has been successful in significantly reducing the prevalence of communicable diseases.
First challenges is having to deal with the anti-vaccine groups. This group has a diverse educational, economic, social and political backgrounds. They use a variety of justification and explanation to make all of their behavior appear acceptable to society and even to the rest of the world. This makes it difficult for the Ministry of Health to acquire herd immunity and stop the COVID-19 outbreak from spreading. However, this does not only happen in our country, it also happens in other countries. Getting vaccinated requires collaboration from everyone, not just the Ministry of Health. The second challenges are giving vaccine to people in the village, rural area and areas that are difficult to access. Most elderly and rural people are not good with technology, which is a challenge for the health of ministry. This is because the interior does not have a strong internet network. The city and modern community register at MySejahtera to acquire a vaccination appointment and location. Without technology facilities in rural regions, the KKM must discover and gather their information to help the government vaccinate all Malaysians.
The first recommendation for the improvement are these anti-vaccine groups should be given clear explanation and information about their misconception about this vaccine. However, the effort to deal with this anti-vaccine group is not only the responsibility of the Minister of Health or the government, but it is the joint responsibility of all parties. All parties should jointly address the issue with effective measures and campaigns. Among the campaigns that can be carried out are through social media, television and radio, because through the right channels, the public will obtain the accurate information more widely and give awareness to this anti-vaccine group. There is no doubt that one of the best measures to deal with this issue is through immunization education, even though it may take time to implement it. The effort to change the thinking and stance of this anti-vaccine group is indeed difficult, but it is not impossible to do, where there is cooperation from all parties, especially from family members and people around, to help this group to gain awareness. Next, another recommendation is the implementation of programs or initiatives need to be carried out to help the rural community. There are a total of 3 types of vaccination centers (PPV) established by the Malaysian government. The three types of vaccination center is community office, community halls and assembly halls. However, there are no vaccination center facilities available in the rural areas, making it difficult for people living in rural areas such as Sabah and Sarawak to get access to appointments and access to centers that are far from where they live. Therefore, one of the proactive measures that the government can take to deal with this issue is to implement the programs or initiatives to help this group. For example, the COVID-19 vaccination outreach program is able to help the rural residents because they can get a walk-in vaccination injection at the said center. Through this method, the vaccination process in these rural areas will run smoothly and the difficulty to registering their names in the MySejahtera application can be overcome. In addition, efforts to establish mobile vaccination centers need to be carried out and intensified in rural areas so that they can help those living in rural areas to get vaccinated. If this effort is implemented, the people in these rural areas will only have to come to a special center established by the mobile vaccination team close to the area to get the vaccination appointment.
For the conclusion of the project, since the whole world is shaken by the COVID-19 pandemic, which is a contagious virus that can cause death, the government has been made an initiative by giving vaccine to Malaysians to prevent infection and death rates among Malaysians. Indirectly, sustainable development goals can be continued and preserved. Since the emergence of a COVID-19 virus, the public began to know and be aware of the importance of vaccines and immunizations in the prevention of infectious disease. The importance of taking this vaccine does not only involve new diseases such as COVID-19, but also type of disease that have existed for a long time. Vaccine, or also known as immunizations, are one of the methods to build up the body's natural defenses against disease attack before a person gets sick. This can prevent a person from being infected and infecting other individuals too. Thank you. That's all from us.